Welcome back to the Healthcare and Healing Podcast. I'm Rose.
I'm Isabel.
I'm Dana.
I'm Kira.
I'm Crystal.
And I'm Molly.
Last episode, we discussed European healthcare's response to the first wave of the coronavirus pandemic. Today, we'll be talking about the second wave. Second wave can be understood as a renewed increase in case numbers, hospitalizations, and restrictions after a period of low case numbers. For most countries in Europe, the second wave occurred in the fall of 2020 into the winter months of 2020 and 2021. Just to start us off with a fast and fun question, if you had one newspaper headline to describe the consequences of the lifting of lockdown after the first wave, what would it be? Dana, do you want to start us off?
Yeah, I think Italy's papers would read efforts to return to pre-COVID normal backfire in Italy.
I had a similar one for Lithuania. I had failure to reinstate quarantine has deadly consequences.
For Spain, I had, is Spain jumping the gun on reopening after its first deadly wave of the coronavirus?
For Germany, I think it would look something like overconfidence and underestimation lead to a surge in cases.
Similar to Germany and its surge, I wrote for France, easing of restrictions causes record number of cases in France.
And for the UK, I had Prime Minister hails end of hibernation, but scientists urge caution.
All right, I'm very impressed with all those. I think next up we should start our own paper, but can we kind of expand on those fun articles? Like, could you compare your country's second wave to their first wave response? Just a couple sentences or so. Dana, I'm gonna have you start us off again. Sorry.
Sure. So because of how overwhelmed the Italian hospitals were during the first wave, and how depleted the supplies were at the start of the second wave, and how big of a shortage they had on doctors, there was huge issues when cases started to surge again in the fall of 2020. All of these issues with their healthcare system really prevented Italy from being prepared to handle the second wave and caused even more destruction to their health and to the population because of this.
Yeah, and I think for Lithuania during the first wave, they had, like, unlike Italy, Lithuania had very few cases. But as numbers started to rise in the fall of 2020, the lockdown restrictions were not reinstated. And so the numbers just continued to rise. And then by the time in December 2020, Lithuania was the worst affected country in the world. Kira, do you want to talk about Germany's response at all?
Yeah, definitely. So I think similar to the other two countries. So in November, in response to a spike in cases, Germany instituted something called a soft lockdown. So that means bars and restaurants were closed, but schools and shops remained open. However, by the December months, Germany became the only country in Europe where the daily number of deaths was now rising rather than falling. So much to the dismay of citizens, Germany instituted another lockdown right before the Christmas holiday in an attempt to stall infections.
Yeah, so similar to a lot of countries and similar to the UK's first wave, it acted a little late in terms of getting case numbers down before they got dangerously high, because it was not until October 31st, 2020, when the UK had reached 1 million cases total, that the whole country was finally back under their winter lockdown.
For France, I would definitely say the second wave was much worse than the first wave, as infection rates were very high. As I said in the newspaper article, they reached a record number of daily new COVID cases during that time. And it wasn't until the end of August that the mask mandate was instituted. So it caused kind of like a late response to this surging second wave, which led to a second national lockdown on October 28th in order to contain this spread.
Spain also had a pretty intense second wave. And as compared to the response to the first wave, Spain's approach to the second wave was way more decentralized and less strict overall. A second state of alarm was announced on October 25th, 2020. And for this state of alarm, each autonomous community, so each region in Spain, was responsible for mandating restrictions that they felt appropriately reflected the state of the pandemic in their regions. All ACs or autonomous communities, however, were required to enforce a mandatory countrywide curfew that lasted from 11 p.m. to 6 a.m. Each day.
All right, it seems pretty across the board that the second wave was worse than the first wave. And a little bit later in the podcast, we're going to talk about maybe the reasons why this might be the case. But first, I wanted to ask if there were any changes in the healthcare system in your countries as a result of the second wave, mainly because in Lithuania, there weren't any real changes, which I think was part of the problem. In the first wave, the hospital system was restructured to allow 20 hospitals to treat coronavirus patients. And these hospitals were meant to be consistently staffed with doctors and nurses. However, during the intermittent period between the first and second wave, nothing was done to strengthen or prepare these hospitals for the second wave. And they quickly became overwhelmed as hospitalizations increased and as healthcare workers themselves contracted COVID-19. So was any country different in this regard?
Yeah, I would actually kind of say that Italy was the reverse of Lithuania. So the most noticeable change from the first and second wave is the response from the central government. In previous episodes, I've kind of mentioned how decentralized their healthcare system is and how each region was able to determine whether or not they should go into lockdown in early 2020. But by March, the government had taken control and re-centralized in a way. And this is also true for the second wave. Instead of starting off with regional lockdowns, the government just mandated a total country lockdown when cases started to surge again. I found that the central government made over 160 national decrees during the first and second wave in an effort to unify the country and send supplies to the regions that needed them most.
Very interesting. So going back to the difference between the first and second wave, how do you guys find that pandemic fatigue contributed to the devastating effects of the second wave for European countries? Anyone can jump in.
I would say that in the second wave, actually economically, it hurt Italy more. So Italy's small businesses suffered the most during the second wave. Almost 75% of their population is employed by these locally run independent enterprises. And if they were able to survive the first wave of lockdown, then they really, really started to fail in the second.
Yes, that was the same for France as well. So in the second wave, French small businesses suffered greatly, and they required supportive measures from the government, similar to how the US helped out with supportive measures for small businesses as well. And also French citizens were becoming very angry at this time because the government was instituting draconian laws, very strict laws that wrongly punished peaceful protesters during this time, including unwarranted fines, arrests, and prosecutions as a result of pandemic protocols at these protests.
Anyone else notice pandemic fatigue?
Yeah, I can comment.
Sorry.
I can comment a little bit on Spain's pandemic fatigue during the second wave. There was a shortage of healthcare professionals in Spain, and that proved to be an issue throughout the pandemic. And then by the second wave, doctors and nurses were highly burnt out, and Spaniards were increasingly frustrated with the national government. And an overwhelming majority of the Spanish population wanted autonomous communities and the regions to be in charge from the start.
I think one unique element for the UK was that one of the biggest elements of pandemic fatigue was the holiday season. It was especially challenging as after almost a year of isolation, families were told that they would be allowed to form a 3-family bubble for the week surrounding Christmas. Later, as cases rose, this was amended to allow holiday bubbles to only include merging with one other family in most regions, and in some only for a single day on Christmas. But as case rates later showed, even this small concession led to a dangerous spike in January 2021.
Aside from pandemic fatigue, were there any other specific challenges that your country faced in responding to the second wave?
Yeah, I think for Germany at least, what we saw at the beginning of the pandemic was a high number of ventilators, pretty capable hospital staff, and lots of hospital beds for the people. As it started to surge in the winter months, they saw some staffing shortages in certain hospitals. For example, Frankfurt Hospital is one that comes to mind. So as more and more doctors actually became infected themselves, care actually took a toll where there weren't enough doctors on hand in certain hospitals to care for the coronavirus patients. And then just to kind of reiterate before, I know we stress this point a lot, but pandemic fatigue was hitting Germany pretty hard as well along those Christmas months. People were just looking to get together, but the more and more lockdown restrictions were put in place, the more and more people kind of pushed back and protested against them.
Yeah, I think Lithuania also suffered from pandemic fatigue, but they had a delay in their lockdown reinstatement. And I think the main reason for that was the election and a change of parties. So Lithuania had an election in October 2020, and the populist center-left government was replaced by a liberal center-right coalition. And it was kind of obvious that maybe this election caused a delay because the new Prime Minister of Health and the new Prime Minister were sworn in early December, and the lockdown was reinstated like days later. So it seemed like every country had its own difficulties in dealing with the second wave. But thank you so much for joining us for today's episode. To recap our discussion today, many European countries were hit harder by the second wave than they were by the first. This is due to multiple causes, including pandemic fatigue, failure to reinstate lockdown, and political disarray. While we do offer criticism for government responses, we also want to acknowledge that the second wave was a time of great fear and uncertainty around the world. Join us in our next episode as we discuss how the centralization of government affected healthcare responses to COVID-19. Thank you.